Dear students, let us discuss about the fascia lata. After listening to this discussion, you should be able to answer the following questions. What is fascia lata? What is its extent? And what are the specialized components of fascia lata? Then you have to answer for a clinical question. Why during palpation of abdomen a patient is asked to flex his thigh at hip joint? With these questions at the back of our mind, let us start the discussion. The word lata is derived from Latin, which means broad. So the fascia lata is the deep fascia of thigh, and it is a broad fascia, and it forms a thick stocking-like membrane in the thigh and gluteal region, and its shape is like a funnel with the wide mouth above. In this picture, you can see the fascia lata or the deep fascia of thigh, okay, in relation with the thigh on its lateral aspect you are seeing. So it is extending onto the front and onto the back of the thigh, and it extends from the hip to the knee. Let us see the features of fascia lata, and it is thick on the lateral aspect where it forms what is known as iliotibial tract, whereas it is thin posteriorly and in its medial part. And in this picture you can see the fascia lata or deep fascia of thigh on the front of thigh and on the medial aspect, and partly on the lateral aspect where it is thick and forms the iliotibial tract. In this picture you can see the iliotibial tract, and the medial part it covers the adductor muscle, and while extending down around the knee it is thick and it receives expansions from the biceps femoris laterally, sartorius medially, and quadriceps femoris anteriorly. Now let us see its attachments. Anteriorly, in the lateral part, it is attached to the outer lip of iliac crest. Then when it comes anteriorly, it is attached to the inguinal ligament, the lower margin of the inguinal ligament it is attached, and medially it extends towards the pubic tubercle, the pubic crest, the pubic symphysis. And when we see its attachments posteriorly in the upper part, it's attached to the sacrotuberous ligament, the sacrum and coccyx it is attached, and also to the ischial tuberosity it is attached. So these are the attachments of it anteriorly in the upper part, and extension onto the posterior aspect. Another attachment of importance of fascia lata is it gives attachment to the membranous layer of superficial fascia of lower abdominal wall. There are two layers of superficial fascia in the lower part of anterior abdominal wall. They are the superficial fatty layer and the deep membranous layer, which is known as Karpa's fascia. It is attached to the fascia lata, a finger breadth below the inguinal ligament. The line of attachment of membranous layer of superficial fascia to the deep fascia of thigh is parallel to the line of inguinal ligament, but it is 1 finger breadth below it, and this line of fusion of the membranous layer with the deep fascia of thigh is known as the Holden's line. And you will learn about the importance of this attachment in rupture of the membranous urethra into the superficial perineal pouch, leading to extravasation of urine into the lower part of anterior abdominal wall, but not extending into the thigh because of this attachment of Scarpa's fascia to the fascia lata. This you will learn in detail when you study about the perineal pouches. Coming to the attachment of fascia lata below on the anterior aspect. It's attached to all the bony prominences around the knee, that is, the condyles of femur, the condyles of tibia, head of fibula, and margins of patella. These are the attachments below on the anterior aspect. If you see the attachment of the fascia lata posteriorly in its lower part, it's continuous with the facial roof of popliteal fossa, and below the knee it's continuous with the deep fascia of leg, which is known as the fascia cruris. And if you see in its upper part, below its attachment to the iliac crest, it spreads into 2 layers to enclose a muscle known as tensor fasciae latae anteriorly and the gluteus maximus muscle posteriorly. Here it forms what is known as gluteal aponeurosis. It is the layer which passes deep to the gluteus maximus muscle, and it provides origin to the gluteus medius and minimus muscles. So the important attachment of fascia lata below the iliac crest is it is splitting to enclose the 2 muscles, that is the tensor fasciae latae anteriorly and the gluteus maximus posteriorly. And it gives gluteal aponeurosis, a facial extension that passes deep to gluteus maximus and provides origin to gluteus medius and minimus muscles. After defining the fascia lata and its attachments, let us see the specialized components in relation with the fascia lata. There is what is known as saphenous opening or fossa ovalis, which is a oval gap which is vertically placed, and it is in the fascia lata 3 to 4 centimeters below and lateral to the pubic tubercle. So we will learn in detail about the saphenous opening in a separate discussion. Then another one is the cribriform fascia, which is a sieve-like fascia, and it is a extension of membranous layer of fascia of the thigh. And this cribriform fascia, it covers the saphenous opening, and it has got several openings are there, perforations are there, and through it passes the great saphenous vein, so which passes through the saphenous opening and pierces the cribriform fascia. That's what you are seeing in this picture, the great saphenous vein passing through the saphenous opening and piercing the cribriform fascia to join the femoral vein. So you will learn about cribriform fascia in a separate discussion. Then the other specialized component is the iliotibial tract, so which is the thickened lateral part of fascia lata. This also we will discuss in a separate session. Then you have learnt about the gluteal aponeurosis. The other one is the intermuscular septa. There are two intermuscular septa which are extensions from the deep fascia, and one is the medial and the other is the lateral, and they go to the linea aspera of the femur, which is seen on its posterior aspect of the bone femur. And these intermuscular septa are dividing the musculature of thigh into an anterior extensor group, a medial adductor group, and a posterior flexor group. So these are the intermuscular septa, the medial and lateral intermuscular septa, dividing it into the three functionally different compartments of muscles: anterior extensor, posterior flexor, and medial adductor. So what are the functions of the fascia lata? So the fascia lata is maintaining rounded contour of the thigh. It's a tight sleeve, and it is preventing displacement of muscles while acting, because it is a tightly adherent one. And because of that, it is helping in the venous and lymphatic return. It is facilitating venous return and lymphatic return. And through the iliotibial tract, it is facilitating maintenance of standing position. So these are the functions of the fascia lata. What is the clinical importance of fascia lata? So its attachment to the inguinal ligament has got importance. The abdominal muscles are taut when the thighs are extended at the hip, because of the attachment of fascia lata to the inguinal ligament. The abdominal muscles will be taut when the thighs are extended at the hip joint. And when we have started this discussion, we have put 4 questions. One is definition of the fascia lata, and then its attachments, its specializations, and the 4th one is the clinical importance. So why the patient's hip should be flexed while examining the abdomen. That was the question. So before clinically palpating abdomen, one must flex the thigh of the patient at the hip joint, so that the abdominal muscles are not tensed up, resisting palpation. So that's the importance of flexing the thigh while examining the abdomen to relax the abdominal muscles.